Okay. You have to talk to me so I can understand what's going on.
I can't talk to you because they'll hear me.
Who will hear you?
Them.
Who's them?
I can't tell you. They'll hear me.
You know what? I don't want to talk right now. It's okay.
You don't understand. I do want to talk. I just can't.
You know what? We can take a break. Come back in a little while. And then
It's the people in the sky. They're watching me. They can hear everything I say.
Rachel, we're indoors. The sky can't hear you. Nobody else can hear you.
Are you sure? Are you absolutely sure?
Yeah, I think so. You know what? We'll just take a break. She's so adamant that they are in the sky, that they're watching her. There's no sky in here. It's just, some people make my job so much harder than it should be.
She doesn't know me. She thinks she can help, but I don't think she can. They can hear me everywhere. I probably shouldn't even be saying this right now.
Are you ready to talk now?
They say I'm seeing things, but I know they're watching me. My family thinks that there's no one. They think that I'm making this thing up, but I think I need help.
That's good. That's really good. Knowing that you have a problem makes it a lot easier to get fixed.
So, how does this therapy thing work? Do I just lie down on a couch and tell you everything that's going on in my mind, or do you just shoot me up with drugs?
Well, first we need to diagnose the problem. It seems that your delusions are pretty constant, and you're not having any bouts of extreme depression or anxiety, right?
Yeah.
So that rules out bipolar disorder, and just leaves us with schizophrenia. And if I were going to put it under another label, I'd say disorganized schizophrenia.
I'm not disorganized.
I'm not saying that you're disorganized. It's just that the specific type of schizophrenia that you suffer from is a lot less manic than other subgroups. You aren't very emotional about your condition, which leads me to think that you display the flat affect that's very characteristic of disorganized schizophrenia.
I think she might be a quack. What's all this nonsense with the subgroups and the mania and the flat affect? What does that even mean? You know, I'm not having delusions. They're really watching us. You can ask my best friend Donna.
Donna?
Yeah, Donna. She's been my best friend since 9th grade. We even got into the same college. She believes it too, you know, that they're really watching us. I don't know what they want, but they're not gonna stop until they get it.
Rachel, are you ready to get back to talking? Okay, Rachel, so we established that you're suffering from disorganized schizophrenia. And that's really good because now we can go about your therapy and things to help you get less symptoms.
Wait, how can you be so sure that I have a psychological disorder if I'm not the only one who thinks we're being watched?
Really? Who else thinks so?
My best friend Donna, she agrees with me.
Donna?
We've been best friends since high school and went to the same college and whatnot, but, you know, she agrees with me. She thinks that we're being spied upon too. It's almost like we can hear them breathing down our necks as they're spying on us. Anyway, getting back to the therapy thing. How can you be so sure that I have schizophrenia when I'm not the only one who thinks we're being watched?
Donna? The best friend who sees and thinks everything that she's seeing and thinking? Oh god, her condition's a lot worse than I had anticipated.
What do you mean?
Donna's not real. There is no best friend. It's just a hallucination. Sure, she's escalating really quickly in her symptoms, and it's getting really bad. Gosh, I can't goof around this time. Her condition's actually serious. Not that I goof around or anything. All my patients are serious. I take them all very seriously. I'm gonna go now. Well, since you don't believe you have disorganized schizophrenia, I have a video here that'll help you understand the disorder.
I don't want to watch any videos.
Will you just try it? I'm just trying to help you here.
Fine, whatever.
Schizophrenia is a chronic psychosis in which the patient is unable to differentiate reality from fantasy. A main symptom of schizophrenia is hallucinations and delusion. Disorganized schizophrenia, also known as hepiphrenia, is a subtype of schizophrenia. Disorganized schizophrenia is characterized by disorganized behavior and disorganized speech. A symptom of disorganized schizophrenia is difficulty concentrating, which manifests itself as disorganized speech. Disorganized speech includes an inability to stay focused on one topic, repetition, making up of words, and unnecessary rhyming and unrelated answers. Another symptom is disorganized behavior. Disorganized behavior includes difficulty completing tasks, declining overall daily function, lack of impulse control, and unpredictable emotional responses. Disorganized schizophrenia is characterized by a flat affect, meaning they show almost no emotions through facial expression, tone, or behavior.
Well, considering that you can take care of yourself and you don't seem to be a danger to others, I'm just going to start you off with a form of outpatient therapy. I will just write you a prescription for paliperidone, which should help, and you'll be good to go.
That's it?
Yep. Oh, wait, I almost forgot. Do you have a history of irregular heartbeats, high or low blood pressure, high cholesterol, triglycerides, heart problems, seizures, brain injuries, diabetes, cancer, kidney or liver disease, or suicidal thoughts?
I'm having some right now.
What was that?
Nothing.
Okay, so you don't have any of those problems?
Not that I'm aware of.
Then you should be good to go. I will set up another appointment for you in a week. Just let me know how it works out. If there are side effects on there that turn out to be too extreme for you, just let me know. She's really lucky, you know. About 10 years ago, we wouldn't even have these medicines. She'd have to be committed. Back in the 1800s, there would be no hope of her having a normal life. They had primitive medicines, but nothing that would actually ever help schizophrenia. Okay, so
What is this?
it's just a bandage. It's going to help stop your visions by helping heal your brain.
I don't like this.
Well, the only other option is infecting you with malaria, so would you rather have that?
No. Hey, Dr. Green.
Hi Rachel, how have you been doing this week?
Not too good. I'm still seeing things. My delusions are back. Donna is still messing with my mind. The drug you gave me isn't working.
Well, we can take you off the drugs, that'll be completely fine. And we can try a cognitive behavioral therapy. A lot of people have been very responsive to it. I can show you a video if that will help you make your decision, but it's all up to you.
Will this really help?
I hope so. You seem like a good candidate for it. Here.
There's no specific test to determine whether a person has schizophrenia or not, but there are many treatments available to treat it. Antipsychotic drugs are used to treat schizophrenia, but they have minimal effects on disorganized behavior and negative symptoms. 60 to 70% of schizophrenics respond well to antipsychotic medications, but there are many side effects, including drowsiness, restlessness, muscle spasms, tremors, dry mouth, or blurred vision. These are the general symptoms, but everyone reacts differently to antipsychotic medications. A long-term side effect of antipsychotic drugs is tardive dyskinesia. Tardive dyskinesia is a disorder where there are involuntary movements, specifically of the mouth, lips, and tongue, but also sometimes other parts of the body. Tardive dyskinesia occurs in about 15 to 20% of patients who receive antipsychotic drugs. Newer medications, however, are still prevalent and still have tardive dyskinesia as a side effect. Another treatment used is electroconvulsive therapy, or ECT. It involves electrical stimulation of the brain when the patient is under anesthesia. But the most common and well-known treatment for schizophrenia is psychotherapy, specifically cognitive behavioral therapy. Cognitive behavioral therapy is used to identify target problems and issues and that hinder someone from functioning well in society. They help develop strategies to address those specific issues. Cognitive behavioral therapy is self-directed therapy where you figure out your own problems and errors, and the therapist guides you through this process and encourages the patient to identify and change the destructive behavior.
Alright, let's try it. At this point, I'm okay to try anything.
Alright then, let's get started. So, this week, have you had any other delusions other than the fact that people are watching you? Rachel, hi. How are you? How's Donna?
That's funny.
No, but really, how are you doing?
Doing pretty well, actually. I mean, yeah, I still have my times where, I have delusions and hallucinations, but at least now I can differentiate between reality and delusions.
That's great. I'm really happy for
Dr. Green,
you. Yes?
thank you.
You're very welcome.
You have to wait for the chair to stop rocking. He looks like a ghost otherwise.
Okay, so...
I started already.
You need to tell us when you start over, Kayla.
Okay.
How it works out, if there are side effects on there that turn out to be too extreme for you, just let me know.
Okay.
I'm a doctor. Seeing? Oh god. Her condition's a lot. Oh my god. My legs are too long for this. Don't film that.
It's too late.
Okay, so Rachel, it just...
Yeah, no, that was a horrible
You know, like
That's
those vigilantes in those movies that look like so stupid? That's
Yeah.
what you look like.
Yes!
Stop!
They don't know what they want, but they're not gonna stop until they get it.
Rachel, are you ready to get back to talking?
Mm-hmm.
Snazzy!
Snazzy?